Hi everybody, my name is Mackenzie and I'm going to be discussing osteoporosis for my flashcard this week. Osteoporosis occurs when there's a loss of bone density due to a loss of calcium salts. Some pathophysiology for osteoporosis is the use of osteoblasts, which are used to form new bone, and osteoclasts, which reabsorb bone to make the bone stronger. However, when their rate decreases for their functioning, there's a risk of osteoporosis. Higher breakdown of bone than formation of new bone leads to porous bones, and porous bones leads to increased risk for fracture. Some risk factors for osteoporosis include older age. Bone mass is lost a lot faster than it is made. People of ages 20 to 30 have the maximum bone density if healthy. And once that mark hits, the rate for remake of bone decreases over time. Women with low estrogen levels, which is common after menopause, are at increased risk. Women are more common than men to get osteoporosis in general. Having a small body frame size leads to increased risk for osteoporosis because these people are starting out with less bone density than others, which leads, it's a lot easier for them to lose their bone density since they're starting out with less. Having a family history, so if a parent or a sibling has osteoporosis, you're at increased risk. Any sort of eating disorder that leads to nutritional deficits puts you at risk. Long-term steroid use or sedentary lifestyle, meaning if you're not exercising regularly, weight-based exercises are great for osteoporosis to help build the bone. Excessive alcohol consumption, hormone imbalances, and low calcium intake are all factors that can lead to osteoporosis. Having a low parathyroid hormone, calcitonin, or vitamin D lead to decreased intake of or absorption of calcium, which can lead to osteoporosis. Some major signs and symptoms include back pain. This is usually related to a fracture or collapse of vertebrae, which is common. Having a stooped posture, or also known as a hunchback, are key indicators. Fractures that occur more frequently with less force than usual is a sign. This often occurs in the vertebrae, the proximal femur, also known as the hip, the distal forearm, also known as the wrist or the shoulder. Also, having a loss of height over time is an indicator of osteoporosis. There are various ways to diagnose osteoporosis. Most commonly, it's done through bone density testing or DEXA scans. Bone density testing is done by using x-rays to determine the amount of calcium and other minerals that are present in the bone. Bone densitometers are used to test and measure how much of a low energy x-ray beam is absorbed as it passes through the bone. Bones that are more porous, indicating osteoporosis, absorb less x-ray, and those that are dense absorb more. DEXA scans are a type of x-ray that are used to measure bone loss specifically. There are various machines that can be used to test for osteoporosis during bone density testing. T-scores and Z-scores are tools used to compare healthy individuals of the same sex and age to those that are getting tested, and it kind of sees where they fall on the osteoporosis line. Completing a health history with the patient and a physical exam are also required just to rule out, like, is this related to your diet? Is it related to your lifestyle? Or is it actually the bone that's causing the osteoporosis? And then we can rule out and give them some other measures to help them improve their bone quality over time. And there's also various medications that can be given to help reduce the rate of osteoporosis. Thank you so much for listening. I hope that you all have a great week. Thanks.